So I'm Anila Jacob. I'm a pediatrician. I work at Harvard Vanguard and Copley. I've been a pediatrician since 1998. So as a pediatrician, I get to see children from the time they were babies all the way through adolescence and into the early adult years. And they go through so many exciting developmental stages during this time, and it's so fun to be a part of that and see them go through it. I find myself celebrating with families when they bring home a new baby, or when they bring a new sibling home, or when a baby that I saw as a newborn is now graduating and entering kindergarten. And I feel it's such an honor to be a part of that and a part of a family in that way. So I have an interest in developmental and behavioral pediatrics, and I spent some time in child development before I started my job here at Harvard Vanguard. And when babies come in for their well child visits, I talk to the parents about expected milestones, what are normal expected behaviors before I see them again, different approaches they could take to help them along, and are primarily to deal with behavioral concerns, and I tend to focus on that. So I remember the time I was a new parent, and I think every parent comes home with some degree of anxiety. I read somewhere once that the one thing that is certain about life with a newborn is that if you have a vision for how things should be, then you're really opening yourself to feeling that you failed. So I try to tell parents, every baby is different. There are some babies who respond very well to schedules. Some babies don't. Some babies have their days and nights straightened out right away, and some babies take some time. And I really try to tell my parents, just enjoy your baby and really get to know the baby, and then everything else I feel will fall in place. And if it doesn't, I'm there to, help them through it.